Hello, my name is Nicholas Cooper, and I have partnered with the Collective NP Clinic to take a few brief moments to talk about attention deficit hyperactivity disorder, often called ADHD. ADHD is more than just being forgetful or hyperactive. It is a serious health condition that is characterized by chronic and impairing inattention, hyperactivity, and impulsivity, or both. ADHD is most commonly diagnosed in children, adolescents, and young adults. An estimated 4.4% of adults aged 18 to 44 have ADHD, with a lifetime prevalence of 8.1%. ADHD is diagnosed by a licensed professional and, in essence, consists of a combination of symptoms that can include inattention, hyperactivity, and impulsivity, or a combination of both. Inattention can look like a combination of forgetfulness, difficulty maintaining attention on tasks not interesting, appearing distracted most of the time, not completing instructions all the way through, difficulty organizing tasks, refraining from doing things requiring long-term mental strain, or losing things frequently. Hyperactivity and impulsivity can look like a combination of frequent fidgeting and tapping, inability or difficulty in sitting in one place for long periods of time, excessive talking, blurting out answers before questions are completed, or interrupting others. These individual or combination of symptoms begin in childhood and happen relatively often in several settings. It's important to work closely with and collaboratively with your clinician, as symptoms of ADHD can overlap with many other common mental health conditions. In addition to this, it is crucial to use credible sources when seeking further knowledge about ADHD. Some credible sources may include the National Alliance of Mental Health, also known as NAMI, the National Institute of Mental Health, World Health Organization, and the Center for Disease Control. ADHD and its symptoms can present differently over time. As we age, research currently believes that there is a combination of treatment and changes happening in our brain, in our minds, in our behavior, and in our environment around us that can lead to symptoms reaching partial to full remission, which just means that these symptoms are less present, salient, and pervasive in our lives. ADHD is considered a neurobiological disorder that affects people across the span of their life. It is thought to be impacted by numerous parts of the brain in charge of learning, memory, reward processing, and regulating movements and coordination. Current perspectives believe that there are imbalances in chemical messengers in these parts of the brain, specifically norepinephrine and dopamine. This is the underpinning for current psychiatric treatments aimed at treating ADHD. Fortunately, there are numerous treatment options available for ADHD. Current recommendations include a combination of FDA-approved medications, cognitive behavioral therapy, and numerous behavioral techniques, including decluttering routine and planning, breaking down larger tasks, and many, many more. While stimulants, which may include Adderall, Ritalin, Vyvanse, and Concerta, are often considered first-line treatments for ADHD, there are alternative non-stimulant medications that have recently showed promise in treating ADHD symptoms. If you have further questions related to this, please bring them to your next appointment with your psychiatric provider. ADHD is a serious but treatable mental health condition that impacts people across the lifespan in the U.S. It is diagnosed through a thorough psychiatric evaluation completed by a licensed clinician, and current theories believe that ADHD may be due to changes made in the brain and how it communicates with itself. Treatment options are vast and can include a single or combination use of medications, CBT, and numerous behavioral practices and techniques. If you have any additional questions, please feel free to reach out to your provider for additional assistance. other things that we often like to acknowledge is that anyone that is receiving medical or psychiatric care should always make sure that their provider knows about any changes they make to medications, supplements, medicinal herbs, or their diet, as this may influence medications. Along with this, if you begin to experience a medical or psychiatric emergency, immediately contact emergency medical services by either going to your nearest emergency department, calling or texting the National Suicide Hotline at 988, or calling 911. Thank you all so much for your time.